Hello everyone, welcome all to Medway's exciting Insta Live today. Medway is an leading edtech platform for healthcare courses and specialized courses, clinical courses designed specially for clinical knowledge and for budding doctors. Medway is certified with Indian and UK boards, CPD boards for ensuring credibility credibility and success for our doctors. Today, I am Dr. Muskan and we will be conducting a live on the topic that is impacting millions worldwide. That is managing diabetes through advanced nutrition and dietetics. So, we have our expert today that is to we will help us to explore this crucial topic. We have the dietitian Diksha Gupta ma'am. She is an MSc in nutrition and dietetics, a certified diabetes educator with an experience of over 7 years in the field, and she has also worked with very well known hospitals and institutions like Max Hospital and Dr. Mohan's Diabetic Specialty Clinic. Her expertise makes her the perfect guide to help us in this topic today. Welcome, ma'am, and thank you for joining us in the live. Good evening, ma'am.
Good evening.
How are you?
I'm good. How are you?
I'm good as well. So let's start with our live today. Uh, as I have given you an introduction, let's continue with the questions now. So, firstly, I'd like to ask you the first question to start things off with. Can you give our viewers a quick introduction and overview about what diabetes is, what are its types, and how someone can identify if they are at risk of having diabetes?
So, diabetes is well known is a chronic condition. It's basically a metabolic disorder. Generally, what happens when you are consuming your food, it break down in glucose, and pancreatic beta cells produce insulin. So, insulin basically carry the glucose to our cells, and the cells here utilize the glucose into the energy. What happened now in diabetes? When we are consuming food and it's breaking down into the glucose, our body is not sufficiently producing the insulin, or not effective, it's not effective to the cells. So when it's carrying to the glucose to the cells, maybe it's not responding to the cell, or not able to open the receptors, and the glucose is not able to get into the cells, and it's goes directly into our blood and increase the blood sugar level in our blood. So that is the diabetes, the increasing the sugar level into our blood. So there is a different type of diabetes. Majorly is type 1 diabetes, which is an autoimmune condition. Generally, it can be seen in the age of 8 to 12 and 14 to 20 year of age. And it can happen in any ages, but the majorly it diagnoses in these ages. Next is type 2 diabetes. It's a insulin resistance condition. It diagnosed in adults, and it can be having a many reasons of this diabetes, like any eating disorders and hereditary. Weight gain, any kind of medical condition, maybe there's someone having cancer or on a steroid, and due to medication also it can be converted in type 2 diabetes. Next is a gestational diabetes, basically diabetes in pregnancy, generally diagnosed in the trimester of second trimester and third trimester. And after the pregnancy it goes out, and maybe in some after some year it can appear and convert in type 2 diabetes. So there is a basic type of diabetes. Yes.
Yes. Okay, thank you, ma'am. That was a really clear explanation about how diabetes works. What are its types? Now, moving on to the next question, I would like to ask to you about nutrition and the role of nutrition in diabetes. So, what is the ideal diet for managing diabetes, and how do factors like GI, that is glycemic index, and meal planning play a role in this, in managing diabetes?
Sure. So, in diabetes, diet has a biggest role because, like as we know, it's related to a metabolic condition where glucose is unable to utilize properly to the cells. So here, as you talking about the GI, definitely glycemic food, like we follow basically a tool which is called glycemic index that we follow, and it is actually really helpful for managing your blood sugar levels, where we are aware like what kind of food item that we can include in our diet, and what can be it should be restricted or avoid. So the basic, I'll give you the brief, like what kind of diet we should follow. It is basically a complex carbohydrate here. Complex carbo. What is complex carbohydrate? There's a two type of carbs. Is some simple carbohydrate and a complex carbohydrate. Simple carbohydrate basically all the sugary fruits like direct sugar, jaggery, honey, and all the like energy drink, sugary drink, fruit juices. This comes in the simple carbohydrate that should be strictly avoided. And the second complex carbohydrate like whole grains, legumes, and all the these part. And next is your protein. The normal protein and lean protein is required. Next is fiber. Definitely, it slow down the digestion of the glucose. Are you able to hear me? Like, is there any pause?
Actually, ma'am, 1 minute. I'm having some issue with the network.
Okay,
I'll just connect with you. Give me 1 second.
okay.
Just 1 second. Can you hear me? Hello?
Yeah, I can hear you. Are you able to hear?
Yeah, ma'am. Really, apologies for the delay. I'm just having some network
No
issues.
issue.
Let's continue with the questions.
Hmm.
You were talking about the diet factors and how diet management is important. Please go ahead with your answer.
So I was saying follow the complex carbohydrate here, and a fiber rich diet basically we get from the whole grains and whole vegetables, because the fiber basically it slow down the digestion of the glucose, and it help to lowering your blood sugar level, and it help to not to spike the blood sugar levels. Next is lean protein for the build up your muscles, and definitely required for your body functioning. And some fat is definitely is required for your utilization of different vitamins and minerals, and of course a different functioning of our body. So there's a some amount of fat is also it's mandatory in this diet. So it is like a normal diet. Generally we follow with the low GI food. So having a balanced meal followed by low GI, it is perfectly fine all type of diabetes in the all type of diabetes. That would be great.
Okay. Thank you, ma'am. That was a really insightful answer, and I hope our viewers would have learned so much from this answer in managing their diets and which will help in managing diabetes for the diet. So let's move on to the next question, which is what are the healthy habits like exercise and hydration and the meal plans to adopt for management of diabetes?
For definitely, for the first line to managing your diabetes is your managing your lifestyle. So lifestyle has a three pillar. First is your dietary habit, second is your physical activity, and third is your mental health, which has managing your stress and sleep. So when it's come to your dietary habit, so like for it's not like following a particular diet plan. It's when I'm talking a dietary habit, it is like when what are the we are following in a daily routine, like having whole grains in our diet, frequently, having fruits every day, having a proper, seasonal vegetables in our diet, having a healthy fats like nuts and seeds, and low saturated and unsaturated kind of fats in our diet we are including. Okay. And the second, when it's come to physical activity, it is not mandatory like every day you are going for exercise and heavy exercise you are doing. It is like where you are physically active, you are doing your all thing by your own. You are not relying on your technology and machinery every time. As well, you are doing physical activity, like basically exercise 4 days, 4 to 5 days in a week. That is mandatory. It's not mandatory like 7 days you are doing have to do exercise. So if you are 4 to 5 days you are following your diet and proper diet and physical activity, that means you are regular with your routine. Next is when it's come to your stress management. Today's era, we know everyone having some kind of stress. Okay. And some kind of sleep issues as well. So we have to work on that we are sleeping on time, we are reducing our blue light, basically the phone and TV all the time, and as we are working on laptops and all. So we have to reduce that time before our sleep especially. And yes, for reducing your stress, definitely the meditation we can do, or we can have this different kind of hobbies we can include. And also exercise itself is our stress booster, so that we have to do on a regular basis. So these are the things, if we do, definitely it manage your blood sugar level and following like have a healthy life.
Thank you, ma'am. That was a really wonderful answer. It was really helpful. Like, as you told, that stress is a major factor that,
Definitely.
is affecting in diabetes these days, and the lifestyle these days that we are having. The stress levels that we face, even the younger generation or the older generation, we have all these stress factors. So, yeah, exercise is really helpful for the same. And let's move on to the next question. It is regarding the how we will manage the complications which occurs in diabetes. So, could you share how the diet management or the diet plans that we will follow will help in managing the complications like neuropathy and retinopathy, diabetic retinopathy that occurs, and after that gangrene or cellulitis conditions also occur in many people these days. As we have seen, even if a small wound is there, people don't get acquainted, or people don't know that I have got a wound, and then it lands up in very different difficult conditions, as we see, as our doctors also see in our daily routine practice in hospitals about cases of cellulitis, etc. So how would you help us with managing diet so that we don't land up in these complications, or even if we do, we manage these conditions?
So you raise a very important question, because when I see the patients, even they have the diabetes like 20-25 years, they don't know about the neuropathy and what is retinopathy. They haven't ever get the tested for this. So this is a basic, like a very important thing to know everyone like who's dealing with this condition. So majorly it's happened that this complication basically is there's a two type of complication is microvascular and macrovascular. So microvascular is a retinopathy, neuropathy and nephropathy, and macrovascular is a cardiovascular diseases and peripheral arterial diseases. So this happened because of when the diabetes have long term of diabetes, or if someone having a very high blood sugar levels. So it is not necessary you have a newly diabetes and it cannot be a neuropathy and not at all. So for that, first thing everyone has to do who are diabetic, they every year they should do get done yeah, checking their cholesterol level and renal test and their lipid profile and kidney function test every year they should do. Next, whenever like if the person diagnosed with this specific condition, first line is obviously managing your diet, what they are doing. So they have to touch with their healthcare professionals or dietitian and get correct their diet. So majorly the diet, like usually people, if someone having alcohol or smoking, they have to cut down these things. Next is whatever there's a low GI food they have to follow. In the diet they have to be very frequent, following a proper meal plan. Generally what people having, sometimes they are having very high sugar and sometimes they have low blood sugar level because of they are not having their diet on on time. They are having breakfast at 9 and having their lunch at 3 o'clock or 4 o'clock. They're not having any specific time duration. That's why it's affect. There's a lot of fluctuation in their blood sugar level. So they required a proper meal timing, so that blood sugar fluctuation should not be happen. And next is hydration, definitely having enough fluid and water, so that they hydrate properly and they're not having other complication like UTI is very common in diabetes. And common precaution they have to take is, for example, if they're having retinopathy, or always use any glasses so that any kind of dust and these things should not enter in their eyes. And obviously the first is managing blood sugar level, checking their HbA1c level every time. Frequently they should check their sugar levels. For the neuropathy, I would suggest to, keep their feet clean and applying some kind of thick moisturizer every time. They, if there any crack in their heel, they should apply any kind of crack heel cream. So these kind of instruction, as a diabetes educator, I must, say to all these kind of complication if the person having.
Yeah.
So they need to follow it along with their diet. And of course, if the sugar level is very high, I would not suggest very rigorous and exercises to them, because it can lead any kind of other complications. Having a normal exercise, keeping them like having some rest is also very required, because already body having some kind of trauma because of high blood sugar level.
Okay. Thank you, ma'am. It was very insightful and really helpful tips for the complications and how to manage these complications, like, proper time management of your meals, exercise, stress management, proper hydration. These were really wonderful tips for managing complications and day-to-day things that we can do, which are really simple to follow, and we will not be ending up with these complications of diabetes. So thank you for that answer. Lastly, I would like to address to some myths that we will debust today. So the first myth that I would like to ask is, do we really need to avoid all the carbs and fruits in diabetes?
Definitely not. The carbohydrate, all kind of carbohydrate in diabetes a person can have. Majorly, they have to check their blood sugar level frequently. If their sugar level are very high, for example, if they're in an occasion and the person want to eat sweet, they can have sweet. But if their sugar level are normal or under the required ranges, if the sugar level are high, definitely it should be restricted or avoid. So these are the things. Otherwise, all kind of food a diabetic person can have.
Okay. And other myth that I would like to address is that people say that can diet alone reverse the type 2 type of diabetes?
See, only diet alone is a kind of not possible, as I have told. It has to be a proper lifestyle management, and lifestyle management is not only with the diet, it also physical activity and stress management. So if the person having the stress issue and just following a proper diet, it is very hard to reverse the type 2 diabetes, or if someone having in the pre-diabetes condition, they have to work on all three these conditions. So along with, like, if they're following these things, definitely they can achieve their goal.
Okay, ma'am. Thank you for that answer and thank you for your expertise. Moving on towards the conclusion of this live, I hope our viewers have had a knowledge and expertise which you gave and provided to our viewers. They've learned a lot. with it, and your tips are really valuable to our viewers. So, in conclusion to this live, I would ask everyone watching this live, please follow dietitian Diksha Gupta ma'am for all the wonderful advice regarding diabetes and getting educated on the diabetes topic. And also, I would request you all to follow Medway for all the updates and coming upcoming sessions like this. And I would like to conclude this live. If you found this helpful, please hit a like and follow Medway for the same.
Thank
Okay.
you so much.
Thank you, ma'am.
Thank you. Bye.